Ugandan Nurses and Midwives Council have encouraged nurses and midwives to embrace continuous professional development.
That as we graduate and go to practice, we continuously upgrade our knowledge and skills because it helps these nurses and midwives to acquire new knowledge, know how to manage the emerging conditions, and also remind themselves of what they learned and be able to deliver it perfectly well.
Ugandans in the diaspora are now collaborating with local health partners to make a contribution to improve healthcare back home.
Leadership, enhancing leadership for nursing and midwifery as a critical enabler for health systems strengthening. We realize that nurses at the practice level don't have many opportunities for continuing medical and nursing education. So we created this program to target specifically nurses at the bedside because they are always busy breaking their backs, looking after patients. They don't have time to actually go back to formal education in the university and so on, and yet they need these leadership skills. They are leading every single day in making decisions about patients. They are leading every day making decisions about the system in which they work. They are leading every day making decisions about each other. So how do we enhance their capacity to problem solve exactly where they are without having to leave the patient to actually gain the skills they need?
National Healthcare Conferences Uganda, a platform for knowledge sharing for nurses and midwives in partnership with Midwife Community Transformation, has embarked on training nurses and midwives in leadership skills to improve the quality of services offered by nurses.
This is a virtual simulated learning program for nurses and midwives, and it was actually an international program. It included nurses in Uganda, it included nurses in Ireland, it included nurses in the UK and in the United States. So we had an opportunity to leverage ICT to bring nurses globally together to learn about leadership.
In the hospitals where we work, in the healthcare setups where we work, we are leaders by default. You are on duty and you are leading others, you're the head of others. Now once you are in that position, you are mandated to make decisions, to communicate decisions, to involve others so that you all give the best care to the clients or patients that come to us. Now that making the right decisions and communicating them effectively and getting everybody else to work and offer quality care means you need the skills to help you do that. That is why this training is important.
However, much emphasis is now being put on prevention and disease control, and the health sector is encouraged to embrace technology to deliver health information to the population.